All right, everyone. Good evening, good evening, good evening. And welcome to another episode of the Healthy Reset, where we discuss all things related to menopause. All right, so with us we have, as usual, myself, Dr. Z, and Nurse Maria. So
Good night, everyone.
let's dive into what tonight's session is about. So menopause is not just a biological milestone. It's an emotional roller coaster that impacts millions of women worldwide. What if I told you that managing stress during this time can transform this journey into an empowering experience? So, over the next few weeks, we will go through 10 sessions on how to manage the different aspects of menopause. And that goes into things like stress management, the metabolic changes that you go through, inclusive of what non-communicable diseases you might be susceptible to, and everything else in between, from nutrition and exercise to what supplements you need and all of the above. So tonight we launch into stress management and how to prevent menopause burnout. So welcome to another episode of the Healthy Reset. If you're watching live or watching the replay on YouTube, welcome and thank you for your support. And let's dive in. So let's start off with Sarah. Like millions of women around the world, she's starting to experience the first signs of menopause. One moment she feels fine, and the next she's hit by a wave of hot flashes and mood swings. It's an overwhelming and confusing time. Does this sound like you? But Sarah's story is not unique. Menopause is a universal transition and every woman will face. And while it is a natural part of life, it can bring significant stress and emotional turmoil. I'm Dr. Z, and at the White Rose community, I help women to navigate the burnout that can be caused by the menopause overwhelm through effective stress management. And with me tonight, we have the amazing Nurse Maria, our brainchild and co-founder of the White Rose community. And Maria will introduce herself in a little while as we get into tonight's topic, stress management and preventing burnout during menopause. So today's talk, we'll explore practical strategies for managing stress during menopause that are empowering you to navigate this transition with confidence and grace. So now I'll hand you over to Nurse Maria to give us a little transition into some of the aspects of menopause and stress management. Nurse Maria, the floor is yours. You have to unmute yourself, Maria.
Yes. Good night, everyone. And I'm Miss Maria, a registered nurse, midwife, sexual health nurse as well. I would like to say, for those of you who are now joining us and who don't know much about what we do, is that patients' experiences and my own experiences initiated me to start this community, because I, being a healthcare provider, was getting so much trouble and struggles going through this process, because I am still going through this process. And it caused me to initiate the need for a community like this. So many women are suffering in silence. I'm seeing a hand up. I'll get to you in a bit. So many women are suffering silently. And this is our way of providing the necessary information for women who are going through this quietly and don't know where to turn, or sometimes you may be going through it, you have some information, but you do not know what you're experiencing and the effects it is having on you. And so this is the reason why this community came in place. I joined up with Dr. Khan, who is health and wellness, and we merged our knowledge together to bring these programs to women and men, because a lot of the ladies, when we're going through this, we do not tell the gentlemen. So we like to invite the males along as well, so that ladies, if you have the husbands and you know they are going through this experience with you, believe you me, you need to let them know what it is you're going through. So as we touch on this topic this evening, we want to talk about understanding menopause and mental health. Menopause usually occurs between the ages of 45 to 55, but it can start even earlier than that. It can start, for some women, even in the late 30s, even without medical, having surgery to remove the uterus. Or some women, they have that, so they automatically go into menopause. Sometimes you're having treatments, cancer treatment, and other situations going on with you, and it could, medications you're on, it could initiate menopause earlier. So it can start even earlier, but generally speaking, it starts from the age of 45 to 55. It's a natural biological process, ladies. So once we reach this age group, we are alive, this will automatically happen. Some women, the symptoms are worse than others. And some women, they go through it very smoothly. So it's a natural biological process, but hormonal fluctuations during this time in your life can profoundly impact your mental health. Many women experience mood swings, anxiety, and even depression at this time. So understanding these changes is very crucial at this time. It's not just about recognizing the symptoms, but also knowing that you are not alone in the journey. So educating yourself about menopause is important. Education is empowerment. And I want to repeat it. Education is empowerment. When we educate ourselves about menopause, we help the process by reducing anxiety. Recognizing symptoms early and seeking reliable information helps in managing this natural biological transition better. It is therefore important for us to talk about it, seek medical support, and not shy away from discussing it openly. So because if you're not discussing it openly, you're hiding the symptoms, you would not be able to get the necessary help that you need at this time. There are certain key supplements to consider at this point in time. Let's talk about some key supplements that can make a significant difference. We have vitamin D and calcium. You know that D or D3 is important to work along with calcium. What it does, to put it simply, it directs the calcium where to go in the body. It's like a conductor. So it's telling it where to go. We want you to go into the bones, places where the calcium is needed, not to flood the blood vessels and cause it to get blocked. So the D is like a conductor. So it works to conduct and carry the calcium where it's supposed to go. So these, the vitamin D and the calcium are essential for bone health, which is often compromised during menopause. And it's noteworthy to know that as we get older, even though we are in the sunshine, we have we are taking in the sun. However, as we get older and estrogen levels and progesterone levels drop, our bodies are not able to take in the vitamin D from the sun as it used to. Hence the reason why supplementation is important here. Omega-3 fatty acids, important here. They support brain health and can reduce symptoms of depression and anxiety. I'm seeing a hand up again. I'll get to you in a bit. Symptoms of anxiety and depression. We also have B complex. Vitamins, they play a crucial role as well in managing stress levels. And the all-important magnesium glycinate is my go-to. This can help improve sleep quality and reduce irritability. Remember, it's always best to consult with your healthcare provider before starting any new supplementations, ladies. So I'm giving you some practical tips to avoid complications. To avoid complications during menopause, a proactive approach is essential here. So what you need to do is to have regular checkups. Why they are important, they can detect early signs of issues like osteoporosis, cardiovascular problems, cancer, things like that. It is also vital to maintain a healthy lifestyle. We could never overemphasize the importance of a healthy lifestyle, which is a holistic approach. It's not a miracle cure. It's not a one-step something for a miracle cure. So what I'm saying, you're incorporating many healthy things to make a lifestyle change. So that is why it is holistic, it's lifestyle. So all the things that you know that you're doing that is helping to increase the symptoms, there are other things you can do to reduce it. So in a healthy lifestyle, which includes reducing your stress levels, a good night's sleep, at least 7 to 8 hours of sleep during the night, a proper diet, healthy, balanced diet, all of that helps with reduction as well. Exercise, regular exercise, it is so important here because one of the things it would do, it will help you to be healthy and decrease chances of developing chronic diseases, or even if you have already developed chronic diseases like diabetes and high blood pressure, it would help it to be under control. And in some cases, your body starts to perform at a better level. Many cases, some patients or some women do not need to continue the strict regimen of pills that they used to take. So it is important to incorporate a healthy diet, exercise, and all of these things. Also, avoiding smoking and limiting alcohol intake. Staying informed about the potential symptoms and treatment options through reliable sources can help in managing menopause more effectively, ladies. So I wanted to make sure to bring this forward to you just as a reminder to let you know that this is something I myself am doing, and it has helped me a lot because I myself have my issues. At this point in time, I am not shy to say that I have fibroids and I am dealing with them naturally. And because of the fibroids, fibroids with some women would have it and they would not cause bleeding, but in my case, it causes bleeding. And so I am anemic. So what I use iron along a lot of dark green leafy vegetables. I exercise. I've dropped weight by following Dr. Khan's program. Now, I want to emphasize here the importance of weight loss as well, ladies. Losing that extra weight is a plus. I cannot emphasize how important it is to lose that weight. Dr. Khan is a mastermind when it's coming to weight loss, and a lot of his specialties in this area as well. So that is hence the reason why we incorporated all of this to help with the symptoms of menopause. And I want to say that it has helped reduce my symptoms a lot because of my eating, my exercise, reducing stress, my whole lifestyle change. I am not in the state I was in. I used to be in the hospital regularly, taking drips, taking blood builders, iron through IV and things like that, ladies. Healthy eating, exercise, losing weight, lifestyle change is the way to go. I'm not saying it is the only way, but it is a very, very positive step forward towards managing symptoms in the best way possible. So I would like to put you back on to Dr. Khan so that we can continue this session and we will answer all the questions you have in a bit. Dr. Khan?
Hi, everyone, and I'm back. So, everyone, thank you, Maria. That was very informative. So, we have a lot of information tonight to share with you on how to reduce stress during the menopause journey. And as this is one of the bigger topics in menopause, how do you get over all of the overwhelm that comes with the changes? So let's start off with a little idea of what is stress. Um, Stress is the body's response to any demand or challenge. And during menopause, there can be numerous stressors that can come into play. Stress causes an increase in the hormone cortisol, and cortisol has a far-reaching response on the rest of the body, which causes things like what Maria said, weight gain. It can cause changes in your symptoms, like it can make, if you have a problem with anemia or bleeding, it can make it worse. It also makes it hard to concentrate, so things like brain fog get worse. So all of these things are what can happen if you constantly allow that stress to come in. And managing stress is highly important to make a difference in how your menopausal symptoms will affect you. So let's talk about what some of the typical stressors are, right? Now, some of these might sound familiar, and some of them might sound unfamiliar. So some of the typical stressors during menopause are the physical symptoms, the familiar, the hot flashes, the mood swings, the what else there is so many other symptoms that are coming along during that. And what we're going to do over the next 10-part series is go through each group of those symptoms so you can understand how to manage each one with ease. Then there's emotional changes, and that's the mood swings you're talking about. That's the depression. That's the anxiety. Um, that all those things cause you to become even more stressed out, right? Then there's the life transitions, such as children leaving the home. There was called the empty nesters. There's the life transitions of you stressing on the fact that you're going from the reproductive to the non-reproductive period. How does it affect your sex life? How does it affect your intimacy, right? Then you're going through the midlife. Women going through menopause, we know, is between the age of 45 and 55, sometimes younger, right? So you're going through that midlife change. There's career shifts. There's additional expenses that come along if you have, like me, my children are 4 and 7 years old. They're now starting school, and now I have to figure out how to get ready for them to be in school, right? So there's that additional expenses come in. And if you're like many of us in the rest of the world, raise isn't coming anytime soon. So we have that stress, financial stress that's added to our shift of that menopause, the shift that women go through of the menopause change, right? So career changes, money changes. Let's say you have aging parents, have to take care of your parents if one of them has had an illness like diabetes, hypertension, heart attacks, strokes. Then there's also Alzheimer's and the rising cases of Parkinson's and Alzheimer's that are contributing to taking care of your parents and taking care of the elderly as a whole. And then there's societal pressures. All of these are adding additional stress to your menopause change. Now imagine putting all of those on board with the symptoms you're already going through and how much that is causing your cortisol levels to go through the roof. And if those cortisol levels stay up all the time, your blood pressure goes up, your blood sugar is out of whack, you develop things like hypertension and diabetes. It can lead to heart attacks. Your cholesterol is all through the roof, and of course, you're putting on weight and you don't know how to stop it. All right. So, so let's talk about then. Is it at this point? Does anybody have any comments or any questions you would like to ask? Put your hand up if you do. So, if there are no questions, Um, let's talk about some of the signs of stress. There's irritability, anxiety, depression, fatigue, sleep problems, which when you have sleep problems like insomnia can cause stress itself. And then there's difficulty concentrating. All of those things are some of the symptoms of stress. Right. So we already talked a little bit about Maria talked a little bit about the supplements you can take and some of the things you can do. But let's get into a little deeper into what kind of diet will you need to help reduce stress. This is one of the 10 strategies we have. Maria mentioned supplements. She mentioned sleep. She mentioned a few of those. So here's one of the other of the 10 strategies. A balanced diet is rich in fruits, vegetables, and whole grains. And you go, but I have a balanced diet. But here's one thing I tell people to always do: reduce the highly processed foods. And that can make a big impact on weight gain. And those highly processed foods are fast foods as a whole, are considered highly processed foods. And you probably have a lot of highly processed foods in your pantry that are contributing to you putting on weight and it's not and causing you to not feel the way you want to feel. Right, so very much so get into it. And as Maria mentioned, we do have courses in the community where we help you to manage your weight gain or to reduce the weight gain and head into a healthier weight by following some of our steps to get there, right? So things like reducing sugar, alcohol, caffeine can also have a big impact on your weight gain, and therefore, and if you put on weight, then that's going to cause stress itself. Another one is physical activity. Why physical activity? And we'll go through a simple way to implement physical activity in a day. All right. Why physical activity? Because physical activity causes you to have the happy hormones, right? It causes a spike in dopamine, a spike in endorphins. Those hormones make you feel great, right? And when you get them, you actually feel more relaxed and it reduces stress. So some of the physical activities you could use is things like walking. So there physical activity is broken down into three separate groups. There's light activity, which is your daily, everyday moving around, sitting, standing, walking to work. Those are considered light physical activities. That's where they things like the 10,000 steps comes into play. That's a light physical activity, right? Then you have moderate or medium for the physical activity, and these include doing things that like going for a jog, riding a bicycle, going for a swim, yoga, stretching. All of those are considered moderate physical activities, and what they do is they increase your heart rate, but you can still talk while you're doing them. And then there's high intensity physical activities, which includes things like HIIT training, high intensity training. There's things like going for a run, um, doing skipping, brisk walking, swimming, playing a sport. Like I play badminton as a high intensity activity, right? So those are some of the activities you can implement, and it's recommended you implement at least some of those activities throughout your day. And the recommended amount of physical activities is 150 minutes a week, which is 30 minutes a day, 5 times a week. So physical activity is very, very important. But how can we implement physical activity? How do you make the 150 minutes? It looks like a daunting task. especially if you're not into doing a lot of physical activity. Here is my recommendation. Start with 10 minutes in the morning, right? After you wake up, you brush your teeth, do 10 minutes of moderate physical activity. This can be something like yoga or stretching or riding a standing bike or going for a brisk walk, a light run, just for 10 minutes. If you haven't done this and you're not doing this regularly, start with a few minutes. Start with 1 minute, work your way up to 2 minutes. If you're doing this every day, you will see you will start achieving that 10 minutes quite easily. 10 minutes every morning. Now, let's work out the maths on this one. 10 minutes every morning. You're doing 10 minutes 5 days a week. What is that? 50 minutes of physical activity. Wow, we just did 50 minutes. No, let's add an extra 10 minutes to that 50 minutes. Let's do 10 minutes in the evening. So you get home from work, you get home from doing your daily routines. Instead of going and taking a shower, put on your workout clothes, and it doesn't have to be anything fancy. It could be a shorts and a t-shirt. Put on your shoes and go for another little bit of moderate physical activity, a brisk walk, a ride, a light run, um, some skipping, some yoga, anything, dancing if you like to dance. 10 minutes, that's it. No, let's do a little bit more maths. That's 50 minutes in the morning, 10 minutes 5 days a week, 50 minutes in the morning, 50 minutes in the evening. What are we up to? 100 minutes of physical activity. No, let's make it a little bit more fun. We're doing light physical activity because you're walking all day. We're doing moderate physical activity for 100 minutes a week. Now, let's add in 2 days of high intensity activity. So instead of going for just a light walk, you go for a jog for 20 minutes, right? And as I said, if you're not accustomed to doing this, start off in 1 or 2 minutes and then work your way up to the 20 minutes. Doing push-ups, one push-up, start doing one push-up and work your way up to 10 and then up to 20. Start doing some skipping, dancing. Go for, you could join a HIT program. You could find some YouTube videos and do things like Zumba and just all you have to do is 20 minutes of it. Now let's do the maths again. So that's 50 minutes in the morning, 50 minutes in the evening, and 2 days of 20 minutes high intensity activities. Just 2 days. You don't need, and what are we at? 140 minutes of physical activity. That's it. You've just made your amount of recommended activity for the week. Can you do it? I think so. If you're still struggling with it, come find us. We will help you. Right. So now let's get into another technique. Let's get into reducing stress by focusing on mindfulness. Now, mindfulness is all about creating relaxation, right? So the first mindfulness technique is meditation. No, we're not getting into, is it meditation? Isn't it a religious thing? No, meditation is about calming your mind. And to do that, we're going to do a quick breathing exercise. Here's how this works. You're going to take three breaths, 3 deep breaths, and focus. What do you want to focus on? You want to focus on the temperature of the breath going in and out of your body, through your nose or through your mouth, in and out. You close your eyes, you can open your eyes, and you can do this any time in the day. 3 deep breaths. What does it do? The first breath slows down your heart rate. By the time you hit the third breath, you'll notice your brain starts to slow down. You start to become more focused. Are you feeling overwhelmed? Are you getting hot flashes? Are you getting cold sweats? Are you going through these anxiety moments? 3 deep breaths. And if you practice this regularly, you realize for every situation, you start getting into the habit of just taking 3 deep breaths. And all of a sudden, your mind feels calmer. You can try it now. Feel how your mind feels. Focus on the temperature. Remember, you want to get your mind to focus on one thing so that it can stop focusing on everything else. All right. So another easy exercise to do for mindfulness is muscle relaxation. Starting from the top of your head or at your toes, start focusing on each muscle group and say, I'm relaxing my forehead. I'm relaxing my cheeks. I'm relaxing my lips. I'm relaxing my shoulders. I'm relaxing my arms. I'm relaxing my abdomen. I'm relaxing my chest. I'm relaxing my hip, and work your way down to the entirety of your body. Within a few minutes, suddenly everything starts to relax, right? Easy as that. Another good way to do that is to wash your hands, wash your face, and wash your feet. And you'll see how quickly you feel relaxed by just doing those areas. Why? A lot of nerve endings are here, a lot of nerve endings are in your feet, and a lot of nerve endings are up here. And I know I don't have any here, so I can show it off, right? So that's one, those are some of the techniques you can use. Another great technique is talk it out. If you're feeling overwhelmed, if you're feeling stressed out, call a friend, call your partner, call your kids and say, hey, I just need to unload for a little bit. Will you just listen to me? And if you have one person you can do this with, this is an excellent way of doing this. Another way, join our group. We have this wonderful support group here and the White Rose community that's all about reducing stress. Come share with us and let us help you and listen to you about what is going on. Join us on Saturday mornings in the clinic. We'd love to have you come over and just chat with us. We don't mind. And let it all out. This is why the White Rose community exists. So those are some of the things you can do to help to reduce burnout and manage stress. So let's get into one other thing two other things we're going to look at. One is
Before,
hydration.
I don't mean to
Yes.
cut you, but I saw a hand up. I know we were asking if anybody wanted to ask questions earlier. I'm seeing a hand up now.
So all right, I'm not seeing that hand, but just unmute yourself and let your question come. The person raise their hand and then lower their hand. So, all right, well, just unmute yourself and just give us your question.
Okay.
All right, so we're going to dive into the next two things, which is one of them is hydration. Hydration is very important, and that's another easy one. Hydration is any liquid. It doesn't mean it has to be just water. Any low to zero calorie liquid. Does that mean tea with little milk or little sugar in it, coffee with little milk or sugar, soda waters, coconut water, water, uh, healthy fruit juices, all of those are forms of hydration. And you want to hydrate. I always say drink like when you're thirsty. If you carry around a bottle like this, like I do all day, right? And you have it filled up with a liquid, you will drink it once you have it in your hand. Simple as that to hydrate. And the next one I want to mention is sleep. Sleep is a very important aspect of um, of recovery. Sleep hygiene is very important in the fact that without good sleep, they create stress in our life. So we want, and everybody's different. Some people can sleep for 4 hours, some people need more than 10 hours of sleep. Knowing what your what sleep is needed for you is very helpful in your recovery, right? So get into the habit of creating a great sleep routine. How can you do this? By following some simple steps to improve to help with a sleep routine. First off, start off by having a ritual that you start from early in the evening. That can be that could be like turning off a TV an hour or two before you go to bed. It can be creating a room into a cool, quiet environment. Another way to do that uh, is by like not drinking anything like coffee or alcohol before bed. Meditation is great. You can do journaling. All of these things, read a book. But one of the things I want to say is all these LED screens and LED lights we have produces a lot of blue light, and that blue light leads to energy being stored in you, which causes makes it difficult for you to go to sleep. So get into the habit of creating a sleep routine that matches you. Warm showers, if you're not lactose intolerant, a warm beverage like warm milk, all help for you to go to sleep. If you're going to exercise, try not to exercise for at least 2 hours before you go to bed. And remember, large meals before bed can affect your sleep, your ability to sleep well. So let's go back over some of those techniques. So before we close off on this evening session, are there any more any questions anybody wants to ask? All right. So let's go back over the techniques we mentioned tonight. So let's start with the lifestyle changes, a healthy diet, regular exercise, and good sleep. Then the next things we want to do is start working on the brain, mindfulness, meditation, deep breathing, and progressive muscle relaxation. We want to deal with emotional and social support, which is talking it out, getting a support group, and developing self-compassion. And we want to do things like cognitive behavioral therapies, which is one of some of the things we mentioned earlier, which is identifying negative thoughts, positive affirmations, and goal settings, right? Things like herbal remedies, aromatherapy, and acupuncture are great for doing this. Maria mentioned some of the herbal supplements you can use to help to alleviate and help to manage some of the some of the stress management that is needed during the menopause change. So there are some of your techniques for helping to manage stress during menopause. As we go through and build this in the community, we invite you to come and join us. We're working on developing mini courses at this point that can help you navigate through each stage of menopause. So during the next few weeks, we will go through everything from hair loss and skincare to what supplements and nutrition is needed and anything else in between as it comes to menopause. And there are 9 more different sections we're going to go through over the next few weeks to help with menopause. So we're going to get ready to close off. I'll ask Maria to come on and give us a few closing words. Anybody has any questions before we get into closing off this session tonight? You can just unmute yourself and come on and say if you need to say anything. No? Well, if there's no more questions, I'll ask Nurse Maria to close us off this evening. Follow us on The Healthy Reset on YouTube. The channel is right behind me here. You can see it on this side, right? Follow us, look at our videos, help us to grow. Click the notification bell and so to click on the subscribe button so you can get the notifications of when we have live sessions. And we have a bunch of videos on there already that's helping with different aspects, and we'll continue to load videos as we go through the next few to help women navigate the different aspects of menopause. Maria, the floor is yours.
Ladies, I want to tell you all, thank you for joining us tonight. And I want to emphasize the importance of what we spoke about in terms of incorporating a lifestyle change. Start making small changes. Don't go about it in terms of, oh gosh, like when the year comes and everybody make these promises, by the next ending of the month, I'll do this, I'll do that. Make small changes. We want to emphasize, decreasing sugar. If well, the processed food makes us addicted to sugar. So you can start by just decreasing the amount of juice, soft drinks, sweet treats that we love daily, bit by bit. Challenge yourself, and incorporate and put something healthy as a replacement. That is what I did. So, I had liked to drink a lot of juice. So I take my juice naturally now. So you can make your little smoothies, put bananas in it. You could, have the fruits. You're feeling for something sweet, you could use, like me, I started to use like dark chocolate, at least 75% dark, incorporate that. Now, I'm not saying to eat the whole bar one time, but you have to have some self-control. So eat a little piece when you're feeling for the sugary rush, because the dark chocolate is very good. It has iron, it has a lot of healthy nutrients in it to help along too with menopause and menopausal symptoms. So, and I would like you all too to invite a friend to come along. They might be needing help as well, and you may not know, because not everybody talks about these symptoms. Some people find it very embarrassing. So invite a friend or someone you know maybe going through all of these issues, and we welcome anybody who is interested, male, and as well your partners, so that they would be able to guide you and to help you and support you better when they know what you are going through as well, ladies. So we want to say a special thank you for coming tonight, and we want to also let you all know that the clinic is open 9 a.m. to 2 p.m. on a Saturday in Canopia. So we have that address as well on our website. So go in, check, and if you have any questions, you have Dr. Khan and my number, so you could always call us and we would give you further information. Thank you, ladies.
All right, everyone, have a pleasant evening. Our email has been down for a little while. I'm working on getting it back up and running. So if you haven't received any emails, don't worry about it. We'll be back up within the next week. And of course, clinic is on Saturday. We go for a hike, our usual hike every morning, every Sunday morning, 6:30 a.m. from Mount St. Benedict's. And as I said, get on. Here is the link to our WhatsApp chat. It's also on the YouTube page. You can go find it there. And
can you please repeat the YouTube page?
the Healthy Reset. The name is right behind my head over here.
Thank you.
So you just type at the Healthy Reset in YouTube and you'll be able to find it.
Hi, Dr. Khan. Good night.
Good night, Liz.
Hello.
All right, everyone.
Good night. Good night, Miss. Good night, everyone.
Good night, Liz.
You all already have the supplements in the clinic for sale?
We will have them shortly. We're working on getting the list and the suppliers all in place. So within the next week or two, we should have everything in place and we'll start supplying you with the supplements. As we said, when we did this, we initially started off realizing that it's a lot of confusion. It's a lot of confusion, and we just want to work through so we can give you what is best to take at the best time so that we can decrease your confusion so you know exactly what amounts you should be taking and when you should be taking it and what supplements you need. All right?
Okay. A suggestion. You all probably could have some jerseys for sale, because I think some of the ladies may want, they may want to have a jersey with a print. Everyone is different, So probably that should be a thought. Different colors with the print.
Most certainly, we will work on getting some memorabilia for the clinic and some so we can have some promotions going. But come out and support us, and we will keep on to grow for you. And
Thank
we have
you.
the next generation coming on here.
Yes, I realize. Okay, thank you.
All right. Have a
You're
pleasant
welcome.
evening, everyone.